what is a fracture? It's a breach or break in the continuity of both cortex or medullary cavity can be called as a fracture. Why does it occur? Because of an abnormal load over the bone in anatomical position or non-anatomical position. Now, here is how it differentiates. Classification of fractures could be the trauma, type of trauma, okay? It could be a significant trauma or an insignificant trauma. If it's a significant trauma, you get the typical fracture patterns. If it's an insignificant trauma, we'll have to see whether it is a normal bone or an abnormal bone. These are the clues which I want you guys to pick up. Once we pick up the clue from the questions, we know that it is a stretch fracture or a pathological fracture. So, when an insignificant trauma occurs on an abnormal bone, it leads to a pathological fracture. When an insignificant trauma occurs over a normal bone on a repeated times, it leads to stretch fracture. So, few common one-liners which our NBs are very famous for. Most common pathognomic sign of a fracture is abnormal mobility at the fracture site. Most common symptom is the pain. Most common sign is the swelling. Now, let's solve one question and come back quickly to it. This is the famous questions which they love to ask us, okay? Right from my time and even before my time till now, it is continuing. So, the first famous question is, which of the following is a pathognomic sign of a long bone fracture? We know that all these things are going to be there when a fracture occurs. There will be pain on movements, there will be swelling, there will be deformity, but abnormal mobility as the fracture site is the pathognomic sign of a long bone fracture. Okay. Based on this trauma we saw, now look at the injury patterns. Okay, if there is a tension force, okay, there is a tension being given this direction and in this direction. What happens? You develop something called as a transverse fracture. Okay, in the next is the linear fracture. If there is a direct blow, okay, it leads to a linear fracture. Consider there is a pressure coming from this direction. This is an example for a compressive force. It will lead to an oblique fracture. Along with this compression, if there's a shear force, it could lead to an oblique and displaced fracture. Okay, an oblique and displaced fracture. These two are caused by a compressive force. Okay, and if there's a twisting force, okay, there's a different directional force occurring in the proximal end, there's a different directional force acting on the distal end. That will lead to something called as the spiral fracture. This is an example of a green stick fracture. Okay, green stick fracture also, there is a tensor side of the bone, okay, and there is a compression side of the bone. On the tension side, because green stick means there is increased elasticity, that is typical in pediatric bones. So, on the tensor side will be the green stick or the incomplete fracture. On the compressive side is where you will get a buckling like thing. That is called as a torus or a buckling fracture. Okay. If it is a direct high velocity injury, you get comminution of pieces. Okay. This is by the fracture based on the type of force that is acting on that. The other examples are the segmental fractures and the avulsion fractures because of the pull of the tendonous attachment to it. Okay. Now, let's quickly solve a question based on this and come back. Look at this question, directly based, okay, very simple. Match the following type of fractures with their associated mechanisms, okay. Transverse fracture is given, an oblique fracture is given, a butterfly fragment and a spiral fracture, okay. We know transverse fracture occurs by tension force, okay. So, transverse fracture is by a tension force, so 1C, and an oblique fracture is by a compression force, so 2A. So, the only thing following that is this option. So, the answer is B. Okay. Next classification is based on the relationship to the environment. Okay. It could be a closed fracture where meaning relationship to the environment means does the fracture communicate with the outside environment. Okay. That is the definition of a closed and an open fracture. Just because there is a skin injury, that doesn't mean all fractures are open. Okay. It has to be that the fracture site has to communicate. Only then you can term it as an open fracture or a closed fracture. Why is it important? The management completely differs, guys. The main problem with fracture management is infection. So for that, the classification between an open or a closed one remains a pivotal role. Okay. So this is an example for an open fracture where the fracture ends, they communicate with the outside environment. Okay. And a closed fracture, even there could be a skin wound here, just a superficial wound, but the fracture site is not communicating. That is an example for a closed fracture. Okay.